of course, he's been on the front line monitoring the coronavirus outbreak here in Richmond. But often his eye is really most interested in those social determinants of health and trauma-informed care approaches that sort of take a long-term perspective on how our communities may recover from the coronavirus outbreak. So I'm going to turn over to a few questions for Dr. Avula. We know it's been a really difficult last few weeks, about 4 weeks was when we first started really hearing more about the coronavirus outbreak, and you've probably had many long hours and sleepless nights since then. So what are some things, you probably felt a lot of stress, a lot of other parents or caregivers who now have been completely disrupted with how they provide their services to children and families are experiencing all sorts of stress and anxiety. And for kids, healthy caregivers are the most important thing to make sure that their kids are healthy. What advice do you have to parents about staying physically and mentally healthy during this time?
Yeah, thanks so much, Emily, for having me, and happy to be here with all of you. I certainly, on the clinical and public health sides of this outbreak, I bring some expertise. On the family side, I'm just trying to figure it out like the rest of you. Mm-hmm. And so just a little more context about my family. You know, I'm married and have 5 kids, 4 of whom are school-aged, and then a teenager that we adopted when she was 17. She's now 19. And so I think there are all kinds of dynamics at play in terms of my wife, who is a public school teacher and who is now not actively teaching. She's trying to maintain a connection to her kindergartners, but then also trying to figure out, like, how do I do this homeschooling thing at my house? And then, you know, trying to find ways to engage all of those kids across 8 to 19. And it has not been easy.
No.
And so I say that just to say that I think for you on this call, for the audience here, but also probably for the clients that you all are working with, that this is unlike any scenario any of us have ever lived through. And I think recognizing that this situation is so severe in so many ways is probably the place that we should all start, and to be gentle with ourselves and with each other, recognizing the toll that the situation is taking on all of us. So I would start with maintaining physical health, and from the communicable disease standpoint, that means limiting your exposure and trying not to come down with this virus yourself. And that would push me towards just the stay-at-home messaging. The more that we can stay in close quarters with our immediate family, the more that we can avoid going out into public, the more that we can maintain that 6+ foot distancing, the more likely we are to avoid being infected. Secondly, I think, you know, eating well and trying to exercise, and those might seem, at least the exercise part might seem to go against the stay home message, but I think we all recognize that, you know, having some time in your day to walk or run or just be out in nature, but do it safely. I mean, there are ways clearly to do that and maintain physical distancing. And one of the patterns that my family, none of us are runners, but over the last month, as the kids have been out of school, my wife's like, we got to do something. And so now they have adopted a daily Avula family jog, where they do about a 2.5-mile loop around the neighborhood. And it's the same, you know, it's the family that our family that we've cohorted with, and they're cautious about stopping anywhere and just maintaining that physical distancing. So I think, yeah, eating well, sleeping well, and I think particularly for parents who are at home with kids, a time like this might be a time more important than any to keep a regular schedule. I mean, this is a challenge for a lot of my neighbors, our friends, my wife's students, to be rigid about a bedtime and to try to have a predictable rhythm. But I think it does bring a certain sense of order and sanity, certainly for our family and for many of the families that we're in relationship with. And maybe my last thought about this, well, 2 other thoughts. One would be limiting screen time or media consumption, right? Because the media has literally nothing else to talk about than all of the sensational things that are happening as a result of this pandemic.
Mm-hmm.
And overloading on that is just going to exacerbate the anxiety and fear and all of that stuff inside of us. And so really limiting our media intake. And then lastly, just maintaining connections to people we care about, right? Obviously, we can't do that physically, but I have talked to my dad more than I ever have in the last month. And I think for all of us, like 2 weeks ago, I walked into the room and my wife was on a Zoom call with 5 roommates from college that she hadn't talked to in like 10 years. But there are ways that this new way of being is fostering connection with people from different parts of our lives. And so like lean into that and stay connected and stay supported with each other.
Yeah. Dr. Avula, I think we got kicked off Facebook a little bit, but I think we're back right now. So I just wanted to summarize a little bit of what you were saying about the advice for parents. And you were talking about how great it is to have a routine. Your family's going on a daily jog together. Very awesome to hear. Keeping a routine about bedtimes and wake up times and getting a lot of sleep, and then avoiding things like screens that might produce additional anxiety, additional stresses, and making sure when you can to get healthy foods to eat as much to maintain your physical health as well. And those things will also support your mental health in some ways too, right?
Yeah, absolutely. It's a great summary.
Good. Okay. So for anyone who accidentally got kicked off, sorry about our technology snafus. I think this is part of the new normal of life too, of figuring out when Facebook's lives are working and when they're not. So welcome at this point. I see a little live monitor still going, so I think that we're still good. If anyone did get kicked off and missed the beginning, my name is Emily Griffey, and I'm the Policy Director at Voices for Virginia's Children. And we're joined this evening by Dr. Dany Avula, who is the Health Director of Henrico County Health District and the Richmond City Health District. But we're really talking about anything that could apply to families or people who work with kids in the past, like teachers or social workers that live anywhere in Virginia at this point, not even just the Richmond area. So our second question is about what's realistic for children and families in terms of social distancing and avoiding play dates. Should they avoid play dates, playgrounds, going to neighbors' houses? This has been something that's really hard in our family, as my kids are 5 and 2 and want to play with all the neighbors in the neighborhood right now. What's your advice for families?
Yeah. This is like the worst ever because I'm just the bearer of bad news all the time around this.
We all want to be healthy, so it's okay.
Yeah. I think that the whole reason we went through the process of canceling schools and closing down non-essential businesses and closing restaurants and all of these like just completely ludicrous seeming things was because the more that we are interacting with each other and in each other's space, the more disease has the opportunity to spread in communities. And for, your family and your young kids, that may not have significant consequences. I mean, the pediatric data around COVID-19 is actually really good.
Thankfully, it's one of the only points of light, I think.
Yeah, that's right. There have been very few cases of severe illness in the pediatric population. But the issue is that kids, as you all know, love to touch things, love to put things in their mouth, and are great vectors for disease. And so if we want to give the elderly, the vulnerable in our communities a fighting chance, we have got to adhere to the stay-at-home and social and physical distancing guidelines. And so as it relates to the question about what is realistic, should we not have play dates? Should we not go to neighbors' houses? Despite the fact that I think we all yearning for connection right now, we really need to try our hardest to not. And I think that the more it's interesting, just sort of the way that behavior changes throughout a community. I just, from the time that the governor and the CDC announced mask wearing, like how rapidly that has become the norm as I, head to a meeting or head to a media event or whatever. And I think similarly, if families started to go out and do play dates, like that would have a ripple effect in our community that would be really detrimental for the elderly members of our community.
Yeah. So you brought up masks. That was one of our other questions about wearing the mask. The governor announced a few days ago. The CDC has come out with guidance around wearing masks.
Yeah.
So another question about what's realistic. Should kids be wearing masks? And what situations should they be wearing masks? If your family's out on a run, are they wearing a mask? Like what are some of the best practices in that?
Yeah, I mean, the guidance is really when you have no choice but to go out and are potentially put into situations where you can't maintain that physical distancing, that's when mask use is appropriate. Or if you're going to go be in some prolonged indoor space, and let me just back up and say that the whole, like the guidance around masks is not to protect ourselves, because cloth masks and even the medical grade surgical masks don't do much to protect you from inhaling the virus. The masks serve as a physical barrier so that when you cough or sneeze or sing or talk, you're ejecting respiratory droplets into the air that could potentially be inhaled by somebody else. And, some of this data is showing that up to 50% of people infected with COVID-19 are not showing any symptoms at all. They don't know they have the disease. And so that's where like these drastic recommendations to stay at home and now to wear a mask, the mask serves as a barrier to keep your respiratory droplets from entering the airspace. So first I'll answer the kid question, which is, the CDC recommendation is that kids 2 and over do this. Now, as someone who's had a bunch of kids, like that is next to impossible. And so, I've seen some efforts, that families are making to have their kids like be involved in making their own masks, in decorating their masks, in drawing on them, or to incorporate a mask as part of a bigger costume, like a superhero. For example. So that I think we've got to get creative to help make that comfortable and somewhat normal for kids to do. And I think the more that we're all doing it, the more they'll think, oh, this is a cool thing that I just have to do. Now a 2-year-old is really tough. And so we just have to sort of live in that. So
my mother-in-law made an adorable 2-year-old mask.
It's awesome.
Thank you for her sewing skills. I don't have sewing skills. So I cut off a t-shirt sleeve for my 5-year-old, and he gets to wear it, and he looks like a ninja. And so he thinks that's pretty cool. So those are two things that we have for our family. The t-shirt sleeve was a very easy project for us.
That's great.
That's a payoff there. So if we have to go out for any reason to a doctor's appointment or something, we would certainly want to do that.
And the second part of your question is like sort of what are the situations that you should be wearing masks? When you're going on a walk in the neighborhood, those respiratory droplets dissipate very quickly in outdoor air. So that's much less of a concern. But if you do have to go to a doctor's appointment or are going to the grocery store or some other essential trip, those would be the appropriate times to wear a mask.
Okay, great. And then this coming weekend and the next few weeks, it's a lot of holiday times. There's Passover this evening in the next few days, Easter this weekend, Ramadan coming up. What is the advice for families around celebrating these holidays together?
For those of you who live in Richmond City, the superintendent this morning addressed this in his daily message to RPS families, and he was saying, in this time of holidays, it's really disappointing to not be able to engage with families, and so they're Jewish, and as they head into the Passover, they are they're connecting with their families in LA and somewhere else in California, but they're doing it remotely and they're going to share a meal remotely. And so I just thought that was a creative example. It's not going to replace what we might enjoy doing otherwise, but I do think that we all just need to recognize that this is a time like no other, and these are the sacrifices that we've got to make. And let's find ways using technology to maintain social connection and to do it as creatively as we can. But it doesn't change the sort of grim situation that all of us are living through right now in terms of physical contact with others.
Mm-hmm. But even this kind of video contact helps people see their faces, see what's going on. You get a little bit more personal than a text or an email.
Yeah, absolutely.
Yeah.
And I think in some ways, I look at what two of my younger kids have done. They're like FaceTiming with their friends on a daily or every other day basis, and it's cultivating and my kids don't have phones, so this is particularly exciting for them. But it is cultivating a depth of relationship that they may like wasn't really happening just in the context of school or day-to-day play. So I do think, as we leave this COVID-19 season, whenever down the road that is, there will be ways that we have learned to connect with other humans that I think are going to be really valuable for us as a society.
Yeah, that's good. That's a positive thing to think of in this difficult time.
Yeah.
And so we do want to also let people know, I think we're still good to go live on Facebook. And if people have specific questions that we can pull in at the end, they can comment in the chat on Facebook. Or if they have specific ideas, things that they've heard in their communities, we want to hear from you. So part of our work is being a policy organization and really trying to put the pieces together about when policy is failing children and families and what fixes we can put into place, and how do all of these different pieces of the puzzle that really impact our social determinants of health come to play so that we can have the best opportunities for kids to succeed and thrive in their lives. And I know that you're really passionate about connecting the social determinants of health to overall health and well-being, and also understanding how childhood trauma and toxic stress impacts health. Could you explain a little bit more or think through how families experiencing those traumas or hardships can become even more disconnected during this time?
Yeah, for sure. I think it's interesting in these early goings and lots of conversations with our eldest daughter and kind of her circle of friends and family. She was reflecting the other day that for so many folks who have lived in chronic poverty, this isn't that different, right? Like they have learned to survive through all kinds of crises. And in many ways, like this just feels like more of their day to day. Now, there are certain situations where I think this is putting an undue burden on our chronically, our families who've lived in poverty, sometimes generationally. So, for example, you may have a WIC card, but if the corner stores that you were normally going to, like they're running out of stuff. And so transportation serves as a barrier to actually get to a place that will accept your WIC benefit. I think another interesting facet of folks who are experiencing poverty is that many, because of just all of the economic circumstances around COVID-19, there are families who are newly vulnerable, right? People who have lost their jobs for the first time, and maybe we're working in low-wage jobs and we're always kind of on the edge, but now are having to figure this out in a new way, and maybe haven't had the experience of connecting with social services and using governmental supports, and so that's an additional layer of challenge of like learning how to use these systems in a new way and applying for resources that they may have never had to do. So I think there's a segment of our population who are experiencing this vulnerability in a new way. There's a segment who have lived through it and in some ways, unfortunately, are better adapted to it. And then I think that, thinking about our undocumented population, for example, many of them were service workers in the restaurant industry or other non-essential businesses, and they have, so they're going to newly feel a sense of disconnection. And so, I guess if I were to offer anything, and anybody who's in the human services field probably has already started to think this way, but more than ever before, we need to think about the whole family and not just, the kid who might be your client, but really sort of all of the dynamics surrounding where are they spending their time physically? What is their access to transportation? How are they getting to food? And sort of layering all of those different social determinants of food and shelter and transportation and support, and figuring out, in this COVID-19 era, how do we address those in ways that keep them physically safe from the infection, but mentally safe to be able to support what's going on in their house? I mean, I think I've talked in the last couple of weeks about how the different phases of what we're living through in COVID-19 and what we're dealing with at a public health standpoint. You know, at the front end, we're really looking at travel and how do we limit folks coming into communities. Now we're seeing clusters and outbreaks in congregate care facilities like jails and nursing homes. Pretty soon, in the next couple, 3 weeks, we're going to see a real surge on healthcare, and the hospitals are going to be strained. But kind of underlying all of that is the burden that families who are stuck in their home with little outlet and the epidemic of anxiety and depression and potentially domestic violence and child abuse that are gonna come at higher rates because of this context. And we have to just be particularly attuned to all of that.
Yeah, and we're really concerned about all of that, the potential increase in child abuse rates or parents that are becoming just more stressed and anxious during this time too. So I know my colleagues can potentially put some resources in the chat as well. You know, it's really hard for folks who have been teachers and been used to seeing their kids and families every day to now have that focus on the whole family. So I think how we piece together these different resources or help people problem solve on their own or through these sort of video connections are going to be a new way of doing things, really. And hopefully we potentially expose things that can be ways that policy can address these sort of safety net supports in the future too. So I think you mentioned some of the things that, you know, we're learning about to help better shape state policy around direct services. We've been encouraging families to now apply through Common Help online, the portal where you can now access food or cash or health benefits. We've hit the record number of 400,000 people enrolled in Medicaid, and so thankful that Virginia has moved forward with that Medicaid expansion to do that. Do you have advice for how professionals can guide families to access these resources while they are staying home?
Yeah, and I'll just say that my experience with this is fairly localized. You know, my conversations as the health department have really been with my peer agencies in Richmond and Henrico. And a couple of things that I would point to that the city is doing particularly well. One, they've launched a website called RVA Strong, rvastrong.org. And on it is kind of a fairly easily navigable for families, for individuals who may need something in particular. And so there are ways to kind of search for different needs, whether it's food or whether it's daycare or diapers or whatever the case may be. All of those resources are pretty well laid out. My colleague Reggie Gordon, who is the Deputy Chief Administrative Officer for Human Services for the city, holds a cabinet meeting for people from all of those different sectors every Wednesday morning. And so that conversation has been really helpful to populate, one, to identify the challenges that residents of the city are facing, and then to figure out how to populate this RVA Strong website with the right Q&A, the right resources, the right links, et cetera. And then it was an Aunt Bertha platform. It's called OneHelp. RVA.org, onehelprva.org, help1rva.org, help the number one rva.org, and it's a new platform for figuring out where all of these different services live. You can search by zip code and see all of the service providers in their area, and that has more of a regional focus. And then, I think there are 311 here in Richmond, and then 211 more broadly has tried to update resources. Those are a little bit more iffy, but I think each community is recognizing that there are families who are at risk because of this situation. And so I think just understanding what your locality has done to bring all of these resources into one area. This is happening all over the country.
Yeah, and we've seen a lot of philanthropic partners stepping up to be able to provide resources directly to nonprofit direct service organizations, or in the case here, RVA Strong, the Robbins Family Crisis Response Fund, that's trying to help problem solve. We also want to look at ways that we can identify what are some potential long-term solutions for those problems that arise right now, or we can look at potentially how we use SNAP benefits differently for families, or TANF cash assistance benefits differently, so that they can have sort of a long-term plan for some of these supports as well. So one thing encouraging that we've seen the state do is reduce or eliminate any co-pays for Medicaid and FAMUS visits right now, and also encourage the use of telehealth services. Could you explain a little bit about how telehealth visits work, either for sort of a physical doctor appointment or a mental health visit, and why that might be a good option for families?
Absolutely. And the first thing I would say is that when this is all said and done and we look back, I think the catapulting of telehealth into the way that we do things is going to be one of the like really positive outcomes from this COVID-19 era. You know, I've had colleagues at VCU who have been working to try to figure out how do we stand up telehealth for years, right? And there's so many complexities, not only from the technologic standpoint, but from the billing standpoint and from the HIPAA standpoint. And this, you know, this pandemic has brought a freedom to explore these new technologies and modalities. And so basically in the course of a week, VCU was able to, you know, launch telehealth, and you know, sort of days after that, we're doing 1,500 visits a day.
Wow.
And so really, I think, and lots of other health systems and smaller practices have followed suit. And so I say all that to say that I think telehealth has had phenomenal benefits in other sort of rural settings or international settings. But I think population centers are going to see the value of this now, and hopefully we move into a context where this becomes a sustainable way for more and more people to access care. So what are the values? I mean, I think one, that in this time where we're trying to stay at home, where we're trying to limit our you know, going into clinics and hospitals, but two, on the mental health side, telehealth can be a really effective way to deliver services. And we're experiencing this personally as a family. One of our kids had been seeing a provider, and now she is, we're just starting this week with transitioning to telehealth. And so, you know, it's new and it's a little bit awkward, but I do think in the same way that all of us are learning to relate through this medium, I think she'll find that it can be really effective. So yeah, I think it's a great option that we will just see more and more of, which will ultimately create even more access.
Yeah, and you mentioned urban centers using telehealth, but we've been a part of some projects in rural Virginia that have been using telemental health for a really long time too. So it's been even tested and sort of proven in those areas. I know that, you know, folks with private insurance, our insurance is encouraging folks to use telehealth visits when possible. And now this Medicaid flexibility allows families that have Medicaid or FAMUS to be able to use it as well. So I think those are really positive offerings. It's really easy to do a telehealth visit too, right? I've like used pictures and texted a doctor so that I didn't have to like put my kid in front of the screen and make it
that's great.
You know, crazy. So I think that there's a lot of super positive things about that, and more people hopefully will use those as well. And then switching from mental health to another area that Voices focuses on is children involved in the child welfare system. Those may be in foster care or in kinship arrangements with other relatives. Right now, court proceedings are on hold, and there's other obstacles where we're not able to maybe identify children at risk for abuse and neglect because they're not going to schools or other activities. So do you have any advice or thoughts about what other community members or professionals can do to help children in these circumstances involved in the child welfare system?
Yeah, I mean, I think particularly for foster care parents, what you're doing is extremely challenging and also extremely beautiful.
Yeah.
But the goal eventually is for that child to go back to their family. And so whatever ways as a foster parent you can be supportive of helping them maintain a connection through that time and helping them navigate just the craziness of what we're living through, like their blood family in most cases will be an anchor for them. And so recognizing that, creating opportunities for them to FaceTime or Zoom or whatever with their scheduling telephone visits. I think all of the ways that you would operate normally in terms of family visitation, but prioritizing your foster child's ability to do that through technology is what I would recommend there.
And I believe we'll have some more guidance from BDSS too, to post and share this week about how that can happen. But the feds have been pretty clear that telehealth visits and other Zoom calls are allowable during this time too.
And maybe one more element, just, because you don't always have the entire sibling group, thinking about ways that you can connect siblings to their other siblings who may be placed in other homes, it should be a priority.
Great. So connecting with the social workers for each child.
Yep.
Great. So one of the, I'm checking to see if we have any other questions to add here, but one of our last ones was just that all of our activities have stopped. We don't have school, we don't have Little League to look forward to, or sort of other routine things. So what trends and data are you looking at about when we might resume some of these normal activities?
So the data has moved a lot in recent days, largely because of kind of an unexpectedly new downslope in New York City, which has been obviously one of the epicenters of the disease in our country. The last 3 days now, while their death toll continues to rise, and they had a record day today in terms of the number of deaths in that state, they've had 3 straight days of decreasing new cases and decreasing hospitalization. And I think that is an indicator that they may be on the downslope of their disease curve. And so what happened kind of over the weekend and through Monday is that a lot of the models that we're using nationally to say, when is our peak in Virginia going to happen and when will we be through this, they had been estimating sometime between the 2nd and 3rd week of May. And one model in particular, the Institute of Health Metrics and Evaluation out of the University of Washington, has shifted that up to April 20th or so. So what does that mean? I mean, I think we've still got to watch the curve in New York and Chicago and New Orleans and some of these other places that are experiencing just high burdens of disease right now. But if that persists, it means that we may be seeing an earlier peak and hopefully a lower peak because of all of the interventions that we've put into place and the fact that people really are doing the social distancing thing. And that means that kind of through the summer, we should see some petering out in July and maybe into August. So I do think it's in the realm of possibilities that August is when we start to plan and start school again. I think the other real concern, though, is that there's a likelihood that we're going to see a second round of this as we head into the winter months. And vaccine development is still at least a year off from all the estimates that I've been seeing, which means that we may have another bout with COVID-19 before we have a vaccine developed. Now, there are a number of clinical trials going on around treatment, so probably 4 or 5 different drugs that are actively being explored. One, there's an antiviral clinical trial here at VCU for a drug called remdesivir. Last week, the FDA just approved, gave an emergency use authorization for a drug called hydroxychloroquine, which is a malaria drug you've probably heard a lot about. So there may be options. I'm only marginally hopeful, but I'm veering a little off course. The question was, when will things get back to normal?
Or what could we kind of expect?
Yeah.
I love the nerdy science.
I think that if I had to gamble, I would say July, August-ish, we will be able to start lifting some of these restrictions.
Okay. Great. That's good to hear. I think we do have one question that came in from the chat around dental visits. And if a child needs to go to a dentist during this time, what's the best protocol? Can you do telehealth dentistry?
I don't actually know the answer to that. My wife was just talking to one of our friends who's a dentist here in the neighborhood, and she has been fully at home, and their practice has not been doing telehealth.
Okay.
One of our kids has like a loose bracket, and we haven't been able to get him in to get that fixed. So my guess is that unless it's a dental emergency that would need to be handled through an emergency room or through an emergent dental visit, and I think most dental offices and orthodontists are reserving time for emergent cases, but I think a lot of the routine stuff they're deferring for now.
Right. So decide if it's really a painful issue that needs to be taken care of, then maybe try a telehealth approach. See if they would do a consultation over the phone or something in those situations too. Might be something else to try. Let me just check and see if we have any other questions at this point. I think we went a little bit longer than we anticipated because of some of our technology challenges. And so I'll just say for folks who are joining us now at the end of our chat and missed the very beginning introduction, that we are Voices for Virginia's Children. We're a statewide multi-issue advocacy organization, and you can find a lot more resources about how to be an advocate and what state policies we're tracking at our website, vakids.org. So hopefully that our technology will come together so that we can have some recording of this, because I thought the conversation was very useful to me as a parent and how we might think about what is realistic and taking care of our families and of course taking care of ourselves. So my last question to you is, getting back to those routines and taking care of parents, what are you going to do now to relax after our webinar Q&A?
Oh, I wish that was I had a good answer to that, Emily. I mean, it has been an incredibly difficult stretch. I've got 100 emails from the last few hours that I need to catch up on. So I'm trying to at least just get 6 hours of sleep. That is my goal: is 6 hours of sleep a night and have dinner with my family. And hopefully in another month or so, this will start to dissipate. But thank you for making me answer that question in front of everybody.
But those are two routines that you can keep consistent, get the mental, physical wellness in those cases with.
Maybe one just closing thought that I would share, because no one wants to gloss over the reality of how kind of absurd and difficult this time is for everybody. I would say that the upside of this is that crises like these tend to bring out the best in people. And what I've seen, just the outpouring of people who are saying, how can I help? How can I support my neighbor? Can I, is there a vehicle for me to bring a neighbor a meal? And I just think that, like, the way that humans are caring for each other now, like, we don't want to lose that. And post-pandemic, like, I think there are a lot of really beautiful things for us to build on as a society. And so for all of you in your own families and the connectedness that you're building in new ways, and then those of you who are practitioners, finding ways to tap into what's happening right now and to carry it on beyond COVID-19, I think it's going to change us forever, Yeah,
so good. And I'll put in a plug on that arena too, for folks who feel like connecting with their neighbors and other children to speak up as a child advocate. We'll have a lot of opportunities, maybe more than we've ever had in the past in Virginia, to advocate with Congress, with the governor and the General Assembly this year to make sure that we're plugging in those holes in the safety net, that we're lifting up the needs of children and families, and that we're finding these sort of long-term solutions to not let families fall through the cracks, essentially. So we're going to need other advocates to also step up and join us in sharing their stories, raising their voices, speaking to their legislators, and sharing this information too. So that's another way that you can also help your neighbors. All right, well, thank you so much, Dr. Avula, for joining us tonight for this Q&A about children and families, and hopefully I'll get to see you again in person in August.
Sounds great, Emily. Thank you.
Thank you. Take care.